Third degree AV block is also called as complete heart block. It is the most severe type of atrioventricular block in which no electrical impulses from the atria are conducted to the ventricles. As a result, the atria and ventricular beat is independent AV dissociation. The ventricles are maintained by an escape rhythm which is usually slow. A complete interruption of conduction between the SCA node or atria and the ventricles, causing atria to beat at their own rate, ventricles to beat at their slower escape rhythm. This leads to reduced cardiac output and can be life-threatening.
So the thing is called as third degree heart block. There is a complete absence of QRS for almost 3 to 4 cardiac cycles. So it is most serious condition, and it is also caused by ischemic heart disease and some another drug.
Hyperkalemia.
Electrolytic imbalance drugs also. Let's discuss about further discussion.
ECG criteria for complete AV block is AV dissociation. P waves and QRS complexes have no relationship. Atrial rate is greater than ventricular rate. P waves are regular. QRS complexes are regular but slower. PR interval varies. No fixed PR interval ratio. Escape rhythm present. Junctional escape, narrow QRS complex. Ventricular escape, widened QRS complex.
Okay.
Ventricular rate usually from 30 to 50 beats per minute.
Okay. So there is an QRS intervals are maybe vary because due to there is continued P wave occurrence they will be happen, but QRS gets skipped. So PR interval does not ratios are not get fixed due to absence of QRS. And one more thing widened QRS. Okay, widened QRS.
If it is junctional rhythm, narrow QRS.
Okay.
And ventricular rhythm means widened QRS.
Okay. Then
to conclude this topic, in first degree AV block, the PR prolongation is greater than 0.20 seconds. In Mobitz type 1 heart block, the progressively prolonged PR interval is present with a skipped beat. In Mobitz type 2 heart block, no PR interval prolongation and the QP ratio is irregularly regular. In Mobitz type 1, the QP ratio is irregularly regular. And coming to the third degree AV block, there is a fixed ratio of cardiac causes, acute myocardial infarction, especially inferior wall alignment, ischemic heart diseases, degenerative fibrosis of conduction system, cardiomyopathy, myocarditis, post-cardiac surgery, congenital complete heart block, drug causes, beta blockers, calcium channel blockers, digoxin toxicity, and anti-arrhythmic drugs.
okay. So ischemic heart disease mostly it is due to inferior wall alignment. And another thing is what? Digoxin toxicity drugs.
Calcium channel
blockers. Okay.
In metabolic causes, hyperkalemia, hypothyroidism, Lyme disease, sarcoidosis, and amyloidosis.
Okay.
The complications are severe hypotension, recurrent syncope, heart failure, ventricular arrhythmias, cardiogenic shock, sudden cardiac death, asystole, cardiac arrhythmias.
See, one thing is very important. The QRS gets skipped means which will lead to sudden arrest. Yeah, because of due to absence of sufficient cardiac output. So all the organs are waiting to get more oxygen or nutrient supply, but in this condition there is an absence of amount of cardiac output by another more minutes because of 4 cardiac cycles are get skipping now. So it is maybe leads to sudden cardiac arrest and organs ischemias also maybe happened. Next treatment
this is a medical emergency. Immediate treatment are oxygen supply, IV access, cardiac monitoring, treat reversible causes. In emergency management, temporary pacing, transcutaneous pacing, transvenous pacing, as drug induces, atropine, dopamine infusion, norepinephrine, isofentanyl infusion.
Okay, so major thing is about pacemaker. That is important thing we want to do for third degree heart block.
And the permanent treatment is permanent pacemaker implantation.
So this is all about type 1, type 2, type 3 heart block. And okay.
To conclude this topic, in first degree AV block, the PR prolongation is greater than 0.20 seconds. In Mobitz type 1 heart block, the progressively prolonged PR interval is present with a skipped beat. In Mobitz type 2 heart block, no PR interval prolongation and the QP ratio is irregularly regular. In Mobitz type 1, the QP ratio is irregularly regular. And coming to the third degree AV block, there is a fixed ratio of PR interval. There is fixed ratio of skipped beat period without QRS complex are present.